Welcome to all of you guys that are watching this video today. My name is Ellen Rankins, and I am a graduate student with the Equine Science Center at Rutgers University. And so here with me today, I have Dr. Michael Fugaro, who is the owner and founder of Mountain Point Equine Veterinary Services and the current president of the New Jersey Equine Practitioners Association. Dr. Fugaro, I'll turn it over to you and let you talk a little bit about your background.
Well, my background is I'm a University of Pennsylvania grad, veterinary school wise, and I did my internship at University of Guelph in Ontario, Canada, and my surgery residency at Purdue University. And I've been practicing in New Jersey for since 2003. So
Okay.
I have an ambulatory practice, and I also do surgeries.
Well, we are very glad to have you here with us today, and we're going to be discussing vaccinations just a little bit today. So
That's
with
great.
the current situation that's going on with COVID-19, a lot of people have some financial concerns or other issues and are starting to question the importance of administering their spring vaccinations to their horses. So can you talk just a little bit about why we vaccinate our horses and why that's important for horse health?
Yeah, and it's a longer answer to the question than expected. And I think as the years have gone on, I'm certainly, as I came out of school and many other veterinarians as well, a lot of times we followed a prescription of what we were supposed to vaccinate or not. And many vaccine programs should not be a rigid prescription. We really should be thinking as to why we're doing it. And in the current climate, well, let me rephrase that. In the past few years, we're finding more individuals having vaccine hesitancy, both in the human and animal side. People have various opinions and reasons why we should or should not vaccinate. Um, Again, our humans versus our animals. I think we have to think about some of the history of this. Is the reason we've chosen to make vaccines to deal with different diseases that we have infectious natures to them. And some of those infectious diseases can be fatal. Some of them can be very, very highly contagious, such as, say, like strangles, which is Streptococcus equi. And then there are other diseases that have zoonotic potentials. In other words, an infection that can actually go from an animal to a person, such as something like rabies. So these are some of the reasons why we would develop vaccines and consider that. Now, there are other ways of developing an infectious disease control program. And the goal on that is if you want to decrease the incidence of the disease or decrease the severity of the infection of the disease. And how do we do that? Well, the first way we would do it, and you can apply it to a lot of what we're dealing with in the current COVID-19 situation. Number one, decrease the exposure of infectious agents. And in our horse population, that's mostly environmentally related. This whole idea that we're doing in humans of social distancing and lowering the opportunity for people to be in direct contact with other infected individuals, that's one of the ways that you can control infectious diseases. Another way is to decrease the risk factors that might increase susceptibility or decrease the resistance that we see with these diseases. Um, and then the third way is enhance your resistance to disease by vaccinating, okay, whether that's human or an animal. So, you know, you see infectious diseases increase in terms of their incidence when you have overcrowding, increased population density, and we certainly see that in some of our larger farms. When you have horses that are moving a lot, in other words, going to shows, going from farm to farm, those are stressful events for horses. Plus, that movement has potential to spread these diseases to other locations. Again, if you apply it to the current pandemic that we're dealing with on the human side, that's one of the reasons why movement has been restricted for everybody, so that we're not spreading it as frequently and as quickly as it would normally go. The stresses that the animals are under can play a role in the incidence. If they have parasites, poor nutrition, general sanitary conditions, if they're poor sanitary conditions with contaminated water, a lot of manure, a lot of dirty environments, that certainly sets up animals and people as well for increased infectious diseases. If they have other diseases that we see, the one that comes to mind is what we used to call Cushing's disease or PPID. That can suppress some of the animal's immune system, so they're probably a little more susceptible to an infectious disease. Along the lines of sanitary conditions, the rodent population, the bird population, insect population on farms can play a role as well of that. And another scenario is when you're having an outbreak of any type of infectious disease, the whole idea of quarantining and resisting the temptation to move to another location. And that's something that we always have a challenge in our equine population. If people are in a boarding facility, that if there is an infectious disease outbreak, they want to go elsewhere where they're not infected. But the problem with that is then you're spreading that disease to other locations. And so, again, I keep using the analogy of what we're currently dealing with COVID-19. It seems like, and not all of the votes are out yet on it, but it seems like this particular disease came from the Chinese wet markets, where they had live animals and very unique and different species of animals that were in what seems to be relatively overcrowded populations. You have different species that would never commingle with each other, commingling with each other. Sanitary conditions were certainly questionable. There was a lot of movement. There was a lot of human and animal contact with these, and very, very close proximity of these animals and in stressful situations. So that seems like it set up the curve for why we're seeing this pandemic that then went into the human population. It started in bats and has moved forward. So I use that because it's a great analogy, unfortunately, that we're dealing with it right now, but it then explains why do we want a vaccine. And the whole idea of developing a vaccine is to decrease these risks of the disease. You want to, you have to weigh out the options of whether a vaccine is going to be ideal for you. So you want to see if the consequences of the disease are going to outweigh vaccinating. You want to see what the cost of a vaccine is going to be versus the cost of the disease. And to explain that a little bit more, there's something that we don't vaccinate because there's no vaccine for, but a disease that we call equine infectious anemia, and most people know it as the Coggins test that we do. It's not a very fatal disease that we see, but it's highly, highly contagious in horses, and it is spread through flies. And at least in the Northeast United States, we've almost completely eradicated it. And I say almost because we still do have occasional cases in the Northeast. In other areas of the United States, they see higher numbers. But no vaccine was ever developed for it. But the way they've eliminated or almost gotten rid of the disease has been by testing and excluding those horses that have been positive from that area. And if you were in New Jersey, back in the from 50s to the 70s, you would have had a good handful of horses that were EIA positive. And you rarely see, we're lucky to see one every 5, 6 years in this current climate. So it gives you an idea of some of the reasons why you might consider a vaccine over other ways of maintaining uh, an infectious disease outbreak. So again, sorry, long-winded answer for a simple question, but I think you're going to find very few veterinarians that are going to say don't vaccinate. But I do think the conversation is worthwhile, and I think every owner, at least in my practice, I think it warrants a discussion. I think people need to have the discussion, need to voice their opinions on what they feel about vaccines. And I think as veterinarians, we need to listen to our clients, and we may not agree, and that's okay, but we need to express our concerns as to how we can prevent an infectious disease outbreak. Um, and I certainly have some clients that say to me, I don't want to vaccinate. And I give them the risks and what my concerns are with doing that. So I think during this time, while finances are a concern, and I acknowledge that, I think it's something that you probably should budget accordingly and just make sure that you can do it. And certainly you need to have these conversations with your individual veterinarian to come up with a good solution.
Absolutely. And kind of on this topic of discussing what vaccinations would be appropriate for a horse, are there specific vaccinations that are generally recommended for all horses, and why do we consider those? Why are those recommended for most horses?
Yeah, we have two populations of vaccines, we call them. We call them the core vaccines and then the risk-based vaccines. Let's start off with the core ones. They are the encephalitises, Eastern and Western encephalitis. We have rabies, we have tetanus, we have West Nile virus. And West Nile virus just got added to the core vaccine not that long ago. I think probably in the past, I want to say 7 or 8 years ago. I may be wrong on that date. And a core disease, a core vaccine, the AVMA is the one that came up with that definition. And I'll just read to you what their definition is so that it's not my wording with it. A core vaccines are those that protect from diseases that are endemic to a region, meaning that they're pervasive in that area. Those with public health significance, required by law, virulent or highly infectious, and those that are posing a risk of severe diseases. Core vaccines have clearly demonstrated efficacy and safety, and thus exhibit a high enough level of patient benefit and low enough risk to justify the use in the majority of their patients. So that statement is basically saying that as a collective whole, the American Veterinary Medical Association has agreed that the risks of giving the vaccine, having a vaccine reaction, having a swollen neck, a fever, all the other things that go along with any type of vaccine outweigh the risk of actually having those diseases. And let's use the example of something like rabies, which does have human health implications. And the challenge with rabies is, I would say in years past, we would have said it's almost always fatal in humans, but there have been many reports of people that have survived rabies, um, probably in the past 10 or 15 years now, but it still is highly, highly fatal. So that's one particular one that we really have very strong opinions about, making sure that we have our animals vaccinated and protected, just for the fact if an animal were to bite, particularly our small animal population, were to bite a human. So those are the core vaccines. Then we get into the risk-based vaccines. The risk-based vaccines, it's basically doing a risk-benefit analysis. And there's a whole host of those. I'll read those off. But anthrax, which is not one you would think about vaccinating for, but there actually is a vaccine for that. I've never had the privilege of using it. I hope not to, but I haven't had a need. Botulism, equine herpes, which is also known as rhinopneumonitis, equine influenza, equine viral arteritis, leptospirosis, Potomac horse fever, rotavirus, or it's also called rotaviral disease. Uh, there are certain snake bite vaccines, and another one that you would know is strangles. And basically, these category of vaccines, you basically are deciding, okay, what are my risks of either vaccinating or not vaccinating? And is this something that I think is warranted for the area? And there's a handful of them in this list that I recommend for my practice, and we do on a routine basis.
Thank you for that clarification. And so many people might be traveling less, their horses might be traveling less because of the travel restrictions that are in place over the summer when a lot of people do go and show their horses. And so would this change in travel schedule impact at all what of those risk-based vaccines, which ones they might administer to their horses this year?
So I don't know that I can completely predict what's going to happen here. I think there's an argument that right now horses are not in their normal routines. People aren't in their normal routines, both mentally and physically. And our horses are probably not exercising like they normally would. And so there's a question of health. There's a question of, are they being more stressed? And some barns are doing a great job getting the horses turned out and getting them into a quote unquote routine, but it's not their usual routine that they've been into before. So there's an argument that maybe these horses are a bit more stressed and maybe they're a bit more susceptible to infections. And certainly, one of the big ones that we worry about as we talk about horses transporting and shipping, certainly strangles, influenza, herpes, all those play huge roles that we see. I mean, really all of them do, but those are some of the ones that we really worry about. I would anticipate that most of our shows and racing events and other organizations will keep similar vaccine requirements. In years past or most recent years on the show circuit, we found that many of them require flu rhino shots to be done within. It used to be they wanted it within 3 months, but most of them are a 6 months time period. Some will have more strict requirements with it. My prediction is I don't expect it to change very much, and if anything, I would think people should anticipate that it's going to be the same, if not a bit more strict, especially because people are a little bit more sensitive to this whole idea of contagious diseases spreading, seeing what we've seen with COVID-19.
Absolutely. So I guess the next question would be, so you're thinking that we probably won't see a lot of changes, but if someone should make changes this year in their vaccination schedule, or any other year for that matter, then how does that impact vaccination schedules in future years?
Yeah, so there are a few of our vaccines, things like botulism, stomach horse fever, there's a couple other ones that are 2 and 3 shot series. In order to gain the immunity that we're looking for, we expect them to have sequential vaccines, usually within 2 to 4 weeks at a time. And we call those the initial series. And if we have a horse that has broken that, their usual annual booster, we typically recommend them go back to doing the series. So unfortunately, it will actually cost you more, and you'll have to do more vaccines to get caught back up again. So, and this is, I mean, unfortunately, there are economic decisions that we get with this, but I think in this case, it's actually going to cost the client more to not do the vaccines this year. Um, and I would encourage people to do the best they can to try to keep the vaccine schedule as normal. But again, I think all these conversations should happen with your individual veterinarian. They can give you the best suggestions.
Absolutely. So we're going to change tacks just a little bit here and go off in a slightly different direction. So as the president of the New Jersey Association of Equine Practitioners, are you aware, are veterinarians in New Jersey making any changes in their practices or schedules to address any concerns that might have been raised by the COVID-19 pandemic?
Yeah, I mean, I think there's two things that are going on that we can talk about with it. There's the economics of all this, and then there's obviously the human health risk. So let's talk about what we've done as veterinarians. Because of Governor Murphy and for a lot of reasons, but the governor actually did mandate that we had to, all healthcare professionals had to do essential services only. So we did not, as a collective whole, want to prescribe to each veterinarian what we considered an essential service. We felt that every veterinarian is certainly, and by the way, this was not only the New Jersey Association of Equine Practitioners, but also the New Jersey Veterinary Medical Association. We decided that we felt that every veterinarian was a smart individual and could make a definition for what they felt was essential. And one of the things that I had put out there to our equine practitioners was to answer a couple of questions to decide, is it worth going out there? So one, is the procedure necessary to save a life of the animal? Obviously, that would be considered essential. Is the procedure necessary to prevent zoonotic diseases? So if you're going out doing some vaccines, and that certainly has been essential. And there are many veterinarians out there that are doing vaccines for right now. Does it have to happen today? No, but it has to happen at some point, just for human health risks, among other reasons. Is the procedure necessary to reduce pain and suffering to the animal? And that would certainly translate to an essential service. If is this procedure elective and can it be safely postponed to a later point in time? And if it can be safely postponed, maybe the argument is castrations. Do you have to do a castration right now? Can that wait? So I think that's certainly reasonable. And this next one's very important. Will the procedure that you're going to perform as a veterinarian is going to require valuable medical resources? And I'm sure you've been hearing it is about personal protective equipment, and that's caps, masks, face shields. There are certain medications that our human healthcare providers have been trying to even pull from our veterinary supply that helps with people being maintained on ventilators. And they've actually even had us veterinarians put our names on a list that if we would be willing to help if they became overwhelmed even more and needed additional healthcare providers in the human side, if veterinarians could help, and they've put our names in that list. So, we have to think about that side of things. Now, the other and last one on this one is, will the procedure increase the amount of person-to-person contact and the potential exposure to COVID-19? So this is really important, and really all of the practices, small and large animal, equine, however you want to look at it, we've all had to evaluate how we practice and figure out, okay, are we going to be safe for our veterinarians, our staff, our other essential workers, and also our clients, our trainers, our owners. That's really important. When I have clients that, I know have healthcare or health conditions and may be older, I mean, they're a very susceptible population. So there's no reason for me to go out to that farm. And what we've done as my practice is the veterinarian goes with a technician on all calls right now, and we ask the owners not even to be present. And if they're going to be present, they're at least 10 feet away. We don't even give them much of a chance there. This is not the time to be, talking in the barns and hanging out. And so we will go in, do what we need, and then we usually call the client afterwards. A lot of the hospital scenarios are having drop-off services. People are doing curbside pickup with their pets, both small and large animal or equine. And I think the one thing you're going to see um, is from all this, I think you're already seeing it in the human side, but I think telemedicine is going to exponentially show up into our field, and in a good way, I think. And basically, telemedicine are ways of using technology to evaluate, assess, diagnose, and treat um, our patients. Now, it's really tough in medicine in some cases. Sometimes you just physically need to be touching the animal and actually be right in front looking at the animal. So there are some things that we just won't be able to change as time goes on. But it's an interesting time, and it will actually change quite a bit.
Mhm. And do you foresee any of these changes impacting clients who are trying to schedule an appointment for spring vaccination? I think you've touched on it a little bit, but if you want to elaborate a little bit more on that.
Yeah, I mean, I think most of the practices, I mean, all veterinary practices are down, particularly here in New Jersey and in the Northeast. I think, people aren't doing much with their animals. And I think the other thing we need to also be aware of, and I think we're as aware of it as veterinarians as anybody else, is that our clients are impacted, if nothing else, by their discretionary and disposable income that they may have. They may not be able to spend the money that they've had before. I hate to make this all a business discussion, but it is. And the U.S. small businesses in the U.S. employ almost 50% of U.S. employees. I think in 2018 it was like 47%. And when you look at the equine industry, and I thought about this, it's almost exclusively made of small businesses. And you
Hmm.
know, my concern is that some of these small businesses are not going to come out the other end. This is a very hard economic time for a lot of people, and there's certainly health-related concerns. I mean, we saw a significant impact in the racing industry and how the virus spread through. I think initially, our first couple patients that we saw in New Jersey came through the standardbred through Yonkers racetrack. With it. At least that's what it's predicted. And I think a lot of it will come out in about 6 months to a year when they actually are be able to do a really group trace back. But I think this is going to impact a lot of different avenues. So, it's going to impact your schedule and appointment for vaccines. I can tell you right now, the veterinarians want to get out and work normally, just like everybody else wants to be out there. But I think we have to do it smartly. I think we have to be hesitant. I think we have to also acknowledge that we should expect another a potential surge in COVID cases. So it really doesn't matter if we're treating the animals if people are sick from it. So, I have to figure that out.
Absolutely. And are you aware of any talk some about the economic hardship for both sides of the coin here. But are you aware of any discounts or programs for people that might not be able to afford vaccinations for their horses this year, but that do want to provide that care for their horses?
Yeah, I haven't seen any of the organizations that I'm involved with or a national initiative that I've seen offering like low cost vaccines and things like that. I just haven't seen them here in New Jersey or even on a national level at this point. That being said, I think every person, if they are in a financial hardship and say, look, I need to vaccinate my house. I don't want to fall behind, but this is the kind of money I have to spend. What can you do? Talk to your veterinarians. We do have, we may have some discretionary funds. I will say that, veterinary practices are having the same financial hardships as everybody else, but, we can sometimes reach out to some of our large vendors. Sometimes we can get some discounted products on things, although they may be in short supply right now. So I think there are ways to go about that. As far as an initiative that I know of, I don't know of any, but I think you should speak directly with your veterinarian. I think the biggest thing is a dialogue with your veterinarian. I can't think of too many clients I have that have asked me, "Hey, doc, I really need help. I want to do right by the horse. This is what I'm willing to spend." Now we're all in it for the animals too, and I mean, yes, it is a business, and we try to make it work for
Right. Absolutely. So, are there any resources or information that you yourself or the Association of Equine Practitioners thinks clients should know about or have access to, or anything we should just be keeping in mind?
So it's interesting that with the whole COVID thing, people have used their websites as a huge resource, and they've amended and added to their websites very, very quickly. So in times that I wouldn't expect them to be quite as active on those, but ones that you should look for resources both on the COVID side and just general health side with it. Certainly, Rutgers University uh, has put together a whole list of resources both for horse owners, trainers, veterinarians. It's actually a very good collection. The American Veterinary Medical Association has also a lot of great resources. I'm looking at it almost daily to see, as also the American Association of Equine Practitioners also has great resources. Now, with those are our local ones in New Jersey, the New Jersey Veterinary Medical Association, New Jersey Association of Equine Practitioners have added to our websites as well. A lot of them linking to what I just mentioned before, but we do have other resources as well. Um, I also think not necessarily from the COVID side, but just general horse health. A couple of periodicals that I really like for horse owners that I've had, I often refer my clients to go to is the horse and Equus, and specifically Equus in the spring issue of 2020 has a whole discussion about vaccines. Now, I think that was written before the whole COVID thing came out, so it doesn't really reference much of that. But it talks about, all right, I have a geriatric horse, and should I skip vaccines this year? And is that a good thing to do or not do? And so that was a nice conversation that they had in that periodical.
Okay. Excellent. Thank you for those resources. Hopefully, people out there will utilize them. And is there anything that I've missed asking you about that you would like to share with us today?
The only other thing that I wrote a little note to myself to throw in here when we're talking about vaccines is talk about titers in horses. And, in small animals, you may have taken your pet to a small animal hospital, and instead of vaccinating, they may take titer levels and maybe not vaccinate during that time. Unfortunately, titers really hasn't been standardized for horses right now, and you're going to hear it in the news with the whole COVID thing as well. Just because you've been exposed to an infection does not mean that you have protective immunity, and that's the one thing that's going to come out as we progress here with COVID. But the same thing applies with horses, and until they work out the standardization of those, it's really difficult. There are some laboratories that will provide titers of horses for specific diseases. It does wind up being rather expensive from what I've seen. Um, and it's not for all the diseases that we vaccinate for. So, from an economic standpoint, I guess my attitude is as well, if I'm going to spend more money testing for the titer levels and not knowing if that's a true immunity, then maybe I should just vaccinate during that time. And that was actually one of the conversations I was in Equus talking about the geriatric course. Um, so personally, I would like to see titers at some point be effective. It would be nice to be able to use that and maybe not vaccinate as frequently on things. But and by the way, titer levels even in small animals, there's a fair bit of argument as to whether they're protective levels as well, even though it's certainly utilized much more in small animal medicine than we see in our. So I just wanted to add that in there as a little caveat. I wish we had that at our disposal, and maybe another 5, 10 years we will.
Excellent point. Well, thank you very much for sharing your time with us today. It was very educational. I hope our listeners find it was the same for them.
Well, thank you. I appreciate the time.
Yes, of course. Thank you.